Dr. Benjamin Bluestein. I'm a chiropractor here in Hong Kong in the central region. So in this video today we're going to talk a little bit about ACL injuries, how to diagnose them, how they occur, and a little bit some prevention strategies on how to strengthen the leg. Hot topics in sports news is usually speaking about knee injuries. So recently this week, one of the rookies for the NBA, Jabari Parker, has a suspected ACL tear. ACL tears are very common in sports athletes, specifically soccer and basketball, cutting sports, so football as well, and also sports which have trauma such as martial arts or American football. What I usually like to speak about is how ACL tears happen and how to prevent them, which is key for players playing a variety of sports. So ACL injuries, they can occur either traumatically, they can occur with, stepping on somebody's foot or running into them, or they can occur if somebody hits you head on. So a lot of times you get a player that's been hit either straight on or on the side, or that they fall and their knee buckles inward. That can cause a problem with the ligament inside the knee. So the ACL, I'll just bend up our volunteer's leg this way. The ACL is attached in between the two bones between your knees. So you have your femur, which is located on the top. This is your big thigh bone, longest bone in the body, and you have two lower bones here, your fibula and your tibia. Well, your ACL actually is inside your knee, so it goes between the larger bone here to your upper femur, the big bone up here. So what that ligament does is it actually protects the movement inside of your knee joint itself. So when we usually assess patients, if we suspect an ACL tear, we always start with a orthopedic testing. So a big orthopedic test is called the Lockman's test. There are a bunch of other ones. What we usually do is we kind of try and assess to see whether or not the ligament has been damaged. We like to do that on both sides to feel for the end feeling, whether or not there's healthy giveaway or healthy movement or unhealthy movement. So a big thing I like to do is to check my patients even before their season begins, because we like to also give them information regarding their strength and conditioning to see whether or not they require more strength and conditioning for stability or for endurance or for anywhere along the leg chain or hip itself. Other knee injuries that are very common, especially in most sports, are meniscal injuries. So if we take a look back on the knee again, the menisci are the two pieces of cartilage that are located on either side in between that knee joint again. So meniscal tears can also occur with ACL injuries themselves. Same thing with the twisting of the knee or the buckling. We can get tears located in those pieces of cartilage on either side, most commonly on the inside of the knee. So what I usually like to do when that happens, that can occur traumatically, like we said before, or just overuse. So either somebody's pounding, they're jumping, they're not doing it properly, or they're not decelerating, they're not slowing down their body properly with their good quad contraction and as well as stability at your hip. What ends up happening is you get overuse tears in there, and that can lead to locking of the knee. So a patient might not be able to have full range of motion, or it might be pain along the joint line here. So we always try and assess for those both at the beginning of the season, during, and postseason, just to make sure that there's no damage to that cartilage itself. With ACL tears, usually they're quite traumatic and there's always a lot of swelling. So obviously in our volunteer here, he doesn't have any ACL tears, but usually most cases you'll notice noticeable swelling. The knee will balloon up, it'll get very large, and there might be some bruising located on the inside or kind of all around the knee itself. A lot of times, if there wasn't a traumatic injury, they might feel instability in their knee, going up and down stairs, bending, twisting. They might feel there's a give-way feeling or there's some slipping. Patients and athletes, they tend to describe it in many different ways. Sometimes there might not be a lot of swelling in here, but there might be swelling in the back of the knee. So back of the knee, there might be pain or fullness feeling there. All these different kinds of symptoms. It's usually injury dependent and patient dependent. So we usually like to screen the athletes, as soon as it occurs. And if we suspect that, we would like to order advanced imaging for them. Immediately, you should definitely take them out of the game. If you suspect that they've had a traumatic event to their knee, you'd want to take them out of the game right away and get them to sit on the bench and follow the Price rules, which are you want to definitely protect your knee, you want to rest the knee, you want to put some ice on there. So with ice, usually you'll see a lot of swelling around the area of the knee. You want to put the ice kind of above and below and in the back as well. What that'll do is that'll prevent inflammation from setting in, and what that'll do as well is it will decrease the pain to the patient, which is a really important thing. But ice, once the 72 hours has passed, you want to start getting them slowly moving their knee if that's possible. You also want to compress the area, so that'll help squeeze out any of the swelling that has occurred. And you also want to elevate the leg, so at least above the heart. So at least when patients are sleeping or they're sitting on the bench, you want to prop up their knee. Try not to use a ball or something, maybe some pillows or a bag, something to keep them up above the heart so that all of the swelling will go back down. Swelling is a big problem because there's a big balloon of fluid in there that will actually prevent the knee from moving because there's not enough room inside the joint itself. So you definitely want to try and reduce that as much as possible. And then once that occurs, you need to definitely come and see a health professional, either myself, which is a conservative care specialist. So we don't do surgery in here, but we try and assess and treat based on non-surgical methods. And you can also go and see I usually refer them back to a medical doctor or an orthopedic surgeon for a consult to see whether or not they will be a candidate for surgery.